Hey guys, John Adams, the Rehab and Documentation Guru. So today's my day of doing case openings. I've got two, plus I had a meeting, so it's a pretty full day. And the case opening I just did was very extensive and a very complicated patient. He has an issue, I believe, and I want to touch base on it because I think it's something that therapists need to be mindful of. And that is a condition called metabolic syndrome. I've mentioned it previously on a video. Here, I'm going to make my phone so it's more stable. Metabolic syndrome. So there are markers that show if you have what's called metabolic syndrome. And it's something that I had in the past. And so let me explain what it is. Metabolic syndrome is a precursor generally to a lot of disease processes, including setting you up really for diabetes. And as the name implies, you have metabolic dysfunction. And there are 5 markers that you look for. You only need 3 to get the diagnosis of metabolic syndrome. So the first would be adipose tissue around the abdominal area. Now, surface adipose tissue may not be a sign of problematic metabolic disorders. So, for example, there are some heavy people that have normal metabolic symptoms or metabolic processes going on because all their their fat lies in their abdomen but not in their viscera. But having a large abdominal girth often is associated with visceral fat. And mostly, obviously when we talk about viscera, we're talking about things like your liver, your pancreas, your, everything in the gut can get impacted. So for a man, an abdominal girth of 40 inches or more, and a woman, abdominal girth of 35 inches or more is often associated with metabolic syndrome, but that's only one symptom. The other symptom is glucose issues, high fasting glucose. Now, I want to say there's a problem with this. Back in the day when I was pre-diabetic and really showing signs of diabetes, I did not have significant problems with fasting glucose. But what I was getting was definitely some issues with hypoglycemia. So I would crash, and then a sugary food or liquid brought into my body would stabilize me. And when you have hypoglycemia, and it's not caused by taking exogenous or outside your body insulin, it means you have hyperinsulemia. You're producing more insulin than you need. Why are you doing that? Because your body is developing insulin resistance. So anyway, that's a second symptom, is problems with glucose. A third symptom would be problems with LDL and HDL ratio. So I don't remember the typical ratio off the top of my head, but you can look up what is normal versus abnormal ratio. And so you've got problems with that ratio, not so much total cholesterol, even though that is looked at, but more and more studies are showing that total cholesterol is not as big an issue as cholesterol comparison, HDL to LDL. So you can have high cholesterol but have a healthy profile and be a very healthy person. In fact, studies are indicating that as we get older, having higher cholesterol is actually protective. In fact, studies on morbidity and mortality of very old individuals appears to demonstrate that higher cholesterol is more protective for an older adult. So check that out because that goes against some common wisdom that we've associated with cholesterol for a long time. Okay, what am I up to? I'm up to 3. The fourth is high triglycerides. So high triglycerides is indicative of potentially metabolic syndrome. Okay, and what else is there? Oh, and then did I cover high blood pressure? I don't think I covered high blood pressure. High blood pressure. So those 5 things, if you have just 3 of those, you have metabolic syndrome. Now, what does metabolic syndrome cause? Well, all factor inflammatory markers can go up with metabolic syndrome. And we know that people that have predilection for developing diabetes, certain types of cancer, obesity have high inflammatory markers. So this is kind of a perfect storm for your patient. So I regularly talk to my patients about this. The other problem, of course, is that a lot of patients will develop metabolic syndrome issues like high blood pressure and hypercholesteremia. And what will they be put on? A blood pressure medicine and, of course, a statin med. And if you haven't gotten it in your career by now, a lot of Western medicine is about putting a Band-Aid on the wound. The wound festers, but at least we've got a Band-Aid on it. Symptom management rather than disease reversal. Folks, I reversed my diabetes. How did I do that? Lifestyle change. I let myself go somewhat during COVID. And I'm going back to the reversal. And you know what? Feeling a lot better. Getting by with less sleep. Having more energy. Not feeling tired. Not getting so short of breath with basic activities. We have to teach management through lifestyle change. And we as therapists can often be the first one to talk to the patient about that. Because they go into a doctor's office, we know they get minimalistic assessments oftentimes. Some doctors are good. Sometimes PAs or nurse practitioners spend more time with the patient. And they sometimes go over management of lifestyle. But I was in with my son recently he's 17, but he got basically a wellness check as a pediatric, but moving to adult stage. And the doctor was providing all sorts of information that was just, I know, baloney. Why? Because I've looked at current research on management of lifestyle. And so I forget what he was talking about. I'm just thinking, that's not accurate. But I wasn't going to sit there and tell the doctor that. It wasn't the purpose of my visit with my son. Anyway, I want you to be mindful of your general health screening on your patient, because this patient that I had at least 4 of those markers. And I asked him about glucose testing, diabetes. He had only ever had fasting glucose, which is not enough. HbA1c is where it's at, and it never ceases to amaze me that so many doctors still do not get that test on their patients when it's much more indicative of glucose management in their patients. Anyway, all the things that are going on with this guy's life clearly appeared to be metabolic. Guy had bilateral symptoms. When you have bilateral symptoms and they're fairly equal and they're progressive, it could be like this guy's got lower motor or upper motor neuron symptoms in his legs, and he's got associated weakness and loss of sensation and whatnot, but it's kind of an insidious onset. There's no injury. He's had MRIs of his back. He's got no upper extremity symptoms. He's got no vision loss, so I'm not thinking like MS. I'll have to look more into it. I believe there are disorders that can impact just your lower extremities and not your uppers, but that is extremely rare. But he's got all the other markers. He's got the markers for metabolic syndrome. And he's definitely got inflammation. I mean, you can tell from other things going on in his life, which I'm not going to go into detail with right now. But anyway, screen your patients for lifestyle things going on. And metabolic syndrome is, in most cases, reversible. And it just requires the will of the patient to make good changes. For me, it's intermittent fasting and ketogenic dieting. And eventually I'll probably just stick with, ketogenic will, for me, probably be somewhat temporary. And then I'll probably stick with intermittent fasting, which really is healthy. Because I got plenty of adipose tissue to burn, even though I look thin. But I know that waist circumference, even on short little old me, approached 40 inches at one point. Anyway, hope you're having a great day. 2 videos in one day. But this was on my mind, having just seen this patient. Now I'm off to see my next patient, which hopefully will be simple because they're a total joint. Take care and God bless.